President of Health Options Worldwide. And if you've joined us in the past for these webinars, thank you for joining us again. And if this is new for you, we appreciate you joining us. Today we're going to talk about marketing your practice in your hospital and really capturing the hearts and minds of patients to put you in a position so you can experience explosive growth. And, you know, it's commonly thought that a hospital's primary responsibility is to serve its patients, that profits aren't really the primary goal, but rather an essential condition for hospitals to remain in existence. And today what I want to do is focus on how can you drive patients into your practice, into your clinic, into your hospital, maximize profits, maximize sustainability, and really deliver a quality product. We got a lot to cover here, so hopefully we'll have enough time for it all. And as usual, please feel free to ask any questions, or certainly, as you'll see at the end of the slides, my contact information to send me any questions. So again, we're going to focus on the marketing, selling, and advertising of your company with the full focus of bringing in patients and maintaining the ones that you currently have. So let's start off with, what exactly is marketing? And unfortunately, most people get it wrong because they don't know the difference between marketing and selling or marketing and advertising. So what I want to do is really define marketing. And what it is it's simply getting the market to want your product or service. The goal is to get patients to say they want to travel to hospital X, or they want to see Dr. Y, who's the best doctor for hernia repairs or back surgery, whatever the case is. The key word here is process. See, marketing is a process. It involves researching, promoting, selling, distributing your healthcare services. All those things are part of the process of marketing. And when it's done correctly, you won't have to, quote unquote, sell to patients because you've already created the demand for them. And this is why many well-respected top-leading marketing gurus, for lack of a better word, actually say that you don't truly need a sales force if you market correctly. Instead, what you need are order takers, or in this situation, a well-trained office staff who's properly prepared to schedule new patients. And what I want to stress here is well-trained and properly prepared, because once you go through all this work and spread the word, create demand, drive patients into your practice or clinic, you have to have the staff that will be in contact with the patients that will make them want to not only stay and follow through with their appointments, but also come back and refer their friends and family and so on and so forth. If you look at bariatrics, they've done a wonderful job marketing, lap bands, bypasses, things like that. And what they've done is really created an environment that brings patients in and again and again and again. They've done it. Everyone else can do it as well. It takes a little bit of work, but it's possible. Want to define, some of the differences here between marketing and advertising. Now, we're not going to spend too much time on this because it's just a very small sliver of the pie, but most of our clients ask us to help them increase the number of patients served while limiting the amount of money that they have to spend to do so. Advertising obviously costs money, and sometimes it's not the best way to go about driving new business. But what I want to stress here, the goal of advertising is simply to increase sales and increase the awareness of your company or your brand. Okay? So the way I like to think of marketing is think of it in terms of a large pie. Within that pie, there's various components. These components are necessary to really execute a proper plan. Now, the trick here is to allow all these components that you see on the screen to operate independently of each other, but yet allow them to come together to form one large pie, as you can see on the screen. It's very important that this process exists and that you allow it to exist in this manner. Now, common misconceptions. A lot of folks think they know marketing. A lot of folks think they understand marketing. They set out to hopefully put a plan together, and then it falls apart. Why? Well, let's talk about it. The first one, the heart of marketing lies in the punchline. These errors take hold when physicians or hospitals, marketing executives, whomever, lose sight of the main purpose, which is simply to motivate patients to seek care and to seek care with them. Now, as I said before, a lot of folks think that they come up with a clever slogan or some sort of humorous or funny marketing strategy that it's going to drive more patients, and it's a trap. Okay, and yes, clever, creative, witty humor does engage patients, but it can also overshadow the treatment or the technologies or the conditions that you set out to promote. See, the job here at hand is to make the truth fascinating, and the truth is what your hospital does, or what's so special about your physician. What do they offer? What are the success rates? Why is your hospital better than others? Why are patients choosing to go to you? That's what needs to go into the marketing, not the other stuff. Another misconception: physician's office only needs one marketing mechanism at a time. Now, this is a common mistake, especially for small practices. We think of it as under-executing. Implementing only one component of the marketing mix that I showed a second ago on the slides is a big mistake, because marketing areas such as direct mail, telemarketing, brochures, whatever, when executed properly, when all those slices of the pie come together, it can provide a fantastic return on investment or ROI. Yet, a lot of people operate these elements all alone, and it just doesn't work. You're not going to reach the full patient opportunity because you're not creating one full large pie. It's important to diversify your marketing initiatives and to do so as a priority. The third area that's most commonly wrong, for lack of a better word, is that marketing's good enough. That if you come up with a good marketing slogan, the results will be quick and earth-shattering. And this is probably the biggest misconception, is that, hey, we're going to launch our marketing program, and tomorrow thousands of patients are going to rush to our door and want to get seen by us. Now, that's the goal, of course, is to increase patients and of course, increase profits, but it's not going to happen overnight. And miracles will not happen overnight from the result of a marketing campaign. It takes time, and you have to build the foundation the right way. And when you do that, as time evolves, you will grow your patient capture rate, and you will grow profits. Like anything else, to build the foundation, it takes time, and I can't stress the importance of, be patient. Put the time into it, and the results will follow over time. So, mentioned a little bit marketing versus advertising, things like that. Advertising is important, and I just want to discuss, some of the items and strategies that you can use to expand your patient catchment area. So what I want to do here is just highlight a few pros and cons from advertising, because it does make sense in some cases. The cons, what's wrong with advertising? Well, first off, it can be very expensive, especially if it's ineffective because you're not targeting to the right audience, in which case it's just throwing money out the window. What are the pros? Brand recognition. Effective advertising can bring in business. It can bring in a lot of business. An example would be Apple. When you go into an Apple store, you really won't find an associate that's going to try to sell you something. Instead, they're really there to assist you and answer your questions to make it easier for you to buy something. They don't need to sell you. Apple fans have already been sold before they even step foot into any of the stores. And this was done through very effective, targeted advertising campaigns. Now, these customers believe that the product was right for them. I mean, this is the same thing that could happen with any of your practices or hospitals or clinics. And certainly for a lot of our clients, this does. If you're a new orthopedic practice, imagine if you ran an advertisement, you had tons of patients knocking on your door saying, hey, I have this problem. I need my hip fixed. I think you're the right person. You're the right clinic that's going to get me back into living a normal lifestyle, so on and so forth. And it's going to be done. It can happen to your practice, happens to many. It's very powerful and can be very rewarding. You just have to take the right approach for it. Having said that, who do you market to? I hope many of you are familiar with, an internal client versus an external client, or internal patient versus an external patient. It's very important and quite critical to make sure that you're marketing to both. And we're going to define those in a second. In most cases, practices will patients will find practices through external marketing, okay? But they will stay and remain loyal patients and refer their friends and things like that through internal marketing. And so what are they? Internal marketing is just really soliciting patients that are existing patients of the practice, okay? And if you do this correctly, if you do it appropriately, this is where it can become highly effective for hospitals or really multi-physician practices looking to promote, a certain treatment or physician, things like that, going through your current database and making current customers or patients become repeat customers and patients again. External is kind of what it sounds like, and that's finding new patients outside of your database, okay? Bring them in and reaching new audiences. The downside here is that can be very costly and time-consuming because it requires a lot more time, and it actually costs, on average, 5 times more to get one new patient than to keep an existing patient. So it's our belief that if done correctly, you will see great results targeting patients internally rather than externally. But of course, you want to do a mixture of the two. Now, social media is everywhere. The new media, I mean, this is where you're going to connect, and this is where, your patients and future patients are getting their information from. So I think it's very important. I want to spend a little bit of time on this slide because we believe that social media can be broken down into 7 steps that will ensure success. Whoops, excuse me. Let me go back here. Sorry about that. All right, number 1, what's your pitch? The shorter, the better. It's imperative that you make sure you can describe your company in 120 characters or less. I'm going to repeat that. You should be able to describe your company in less than 120 characters. Why? Because so many people are using their mobile devices now. Also, their attention spans are so limited now, given the devices and so on and so forth, that people want to look at their phones, see the information they need to see in a few characters or less, and make a decision. 2, what's the point? Is your social media more for awareness of your brand, your practice, your hospital? Is it for additional patients? Is it for loyalty purposes for your existing patients? There's many reasons why you could use social media to reach out to a targeted audience. The thing is you have to define who is it that you're trying to reach and just stick to one and become really good at that. Third area that's necessary. What is your relationship with the audience? What does your audience know about you today? And there's about five areas that I think that you really have to think about. 1, what does your audience know about you today? Nothing. Or maybe they're aware of you, but never acted on communicating with you. Or maybe they've acted once. Or maybe they've done repeated actions, and they're actually enthusiastic about you. Or maybe they become advocates and they want to help you spread the word about how good your hospital is or your practice. Whatever it is, you pick up 2 of these segments to focus on, but make sure they're adjacent on the scale. Meaning it's too confusing to have a strategy that targets advocates and people that have never heard of you. It's just too conflicting. So the main thing is figure out, who are you trying to reach? What does the audience know about you? And then send your message so you can group them together so that you're going to hit them together, or send different messages that will benefit the both groups equally. Another area to focus on, how does your audience use social media? It's very important to understand how your target patient. Now, let me step back a second. You need to define who your targeted patient is, and that can be by gender, age, geography, whatever. But it's important to know how do they use social media. If your audience is older, then they're going to probably use it differently than if your audience is younger. So it's important that you communicate with them in a way that they're comfortable with. A 5th area, what's your one thing? Now, what I mean by that is, it's critical. It's absolutely critical to know what the soul of your brand is. We like to tell our clients, what's the one thing that defines your practice or your hospital? It's not features and benefits. It's one thing that says it's you. Let me give you an example. The car company, Volvo. their one thing is safety. Apple, theirs is innovation. Disney, magic. You know, what's your one thing? And it's not an easy task. I mean, the large groups, hospitals, I mean, they hire marketing teams and brand managers to really figure this out. But, you know, if you don't have those resources, that's okay. Go out and involve the local community and ask them, you know, why do they choose you? You know, why do patients come to you? What do they like? What don't they like? Things like that. You might be very surprised by the results, but that'll give you an indication to figure out, you know, what's that one thing that represents your practice. Another area, how will you be human? It sounds kind of funny, but that's what social media is all about. Folks on social media, they want people. They don't want logos. They want companies to let down their guard. If you're a small practice or a smaller hospital, it should be pretty easy because this should be, you know, it's what you do every day. If you're a bigger company or a big hospital, it might be a little harder to think about, you know, what can you do to be quote unquote small again. You know, this is social media is an opportunity for patients to believe that you're not just a faceless entity, but instead a place where they're going to get personal attention. It's very important to convey that message to them. And the last thing is, and I think this is one of the most important, what will you do? How will you measure success? There's a number of ways to measure social media success. The key here is just determine what your metrics are before you get started. Understand what is it you're going to do, how are you going to measure it, and then go through the process and measure it. I recommend to our clients that you pick 3 solid metrics to track. Okay, and you know these metrics can differ based on what your objective is for the program. You know, an example could be create a following, allow patients and methods to communicate directly with you and attract more of a specific group of patients. You know, whatever it is, put a number to it that you can quantify and that you can track. So moving on here to the web, you know, as you can see on the screens, folks are looking to the internet to find healthcare information, to find their healthcare providers, to really take care of their healthcare needs. You know, I just read, I think it was about a week or 2 ago, probably a similar article that all of you have read. The major phone companies here in the U.S. are no longer, a majority of them are no longer going to print and publish phone books anymore because no one's using them. Relying on somebody going through the yellow pages to find you is a dead end today. It's not going to happen. People are going online, and they're going online to find the care they need. Healthcare is the 3rd most common reason people use the internet. Email being number 1, e-commerce being number 2, and healthcare being number 3. In fact, interesting stat, 85% of Americans actually use the internet as a primary source for healthcare information. And again, as you can see, there's some more stats here that I find to be pretty interesting. So, you know, we just looked at it from a standpoint of why you need to be online, but what are patients using it for? What are they looking for? What are they asking for? You know, finding a doctor can be very stressful and very confusing. And, you know, patients are using the internet so they can see and compare a wide range of healthcare options, but from the comfort of their home, from the privacy of their home. You know, with the way global healthcare, but also global families are, you know, you might have some family members in a different part of the country or outside the country, whatever, that want to be involved in the process of finding a physician or a hospital. They're using the internet to do that. Everybody can be involved in it, in the search, and it's important to let folks kind of touch you and feel you and all that as best as they can by looking at you online. Now, you know, as we saw earlier, patients are constantly searching online for breakthrough technologies, okay? And if that treatment's not available where they're located, they're willing to get up and travel to find a place that does offer it. And the U.S. is a great example. The FDA, through their review process, so on and so forth, you know, a lot of times they don't approve some of the newer technologies, so folks are leaving the country. In fact, next year, it's estimated about 1.6 million people will leave the U.S. to travel abroad for their healthcare needs, and that number is growing. Now, some physicians are using the internet as a tool to connect with more patients by providing, and this is interesting, by providing free consultations. And what's great is they don't even have to use up valuable appointment time. They can do it on their spare time or after hours. All patients do in some of these examples are just upload a photograph, send the relevant medical records. The doctor is free to respond to them when time allows. Now, what's great is sometimes it's free, sometimes it's a minimal fee, whatever. The interesting thing here is online consultations are responded to, on average, within 48 hours. That's remarkable. Online consultations are responded to, on average, within 48 hours. That's incredibly fast when you consider how long it typically takes, weeks or even months, to wait for an appointment to meet with a local doctor. Don't have to do that anymore. Patients can compare thousands of doctor reviews and ask other patients for their experiences with specific doctors. This is what they're doing today using the web for healthcare. For those that are traveling abroad or leaving their local communities, whatever, being able to see, touch, feel, read reviews, all that kind of stuff from one place online, it's invaluable for those that travel and use it, and they're using it. And you have to be online if you want to capture these patients. So I think I've stressed the importance enough that you have to be online if you want to attract new patients. I think it's only fair now for me to give you a few tips and pearls of, okay, so you're online, but now what? What can you do to make your presence stronger to really capture more people? And, first off, it's important that every doctor has a website. Every hospital, every clinic has a website. If you want to bring in more patients, a website is key to doing this. Now, let me highlight a few of these. Front and center, contact information. Make it as easy as possible for patients to find you. Another, patient education is key. It's very important. Develop a well-written patient education content, okay, within your site, including treatment and disease information and things like that, so folks can read about you, so they can understand, not only what they need and why they need it, but why you're the best, why you're the expert to get the job done for them. Testimonials is another. Patients want to hear from other patients, okay, and not just in healthcare, but for any other aspect of really the economy, but in particular within healthcare, they want to see testimonials. Now, online scheduling is something that really will capture many patients. There's a few reasons for that. One is a lot of folks are researching information about healthcare online, and it's 10:30, 11 o'clock at night, privacy of their home, on their own time, and they come to the realization, hey, I need to get seen. They want to book an appointment right then and there, and it's important for you to allow them to do this, because that's, as the old saying, strike while the iron's hot. They want to do this. You should be able to allow them to book an appointment with you, because what happens is the next morning comes along, they get tied up in their day-to-day schedule, and they just don't make time, or they forget to call the office and schedule that appointment. Number one. Number two, some people might have a rare condition or a rash or something, and they just don't want to talk to someone. They don't want to call up and talk to a receptionist and say, hey, yeah, I have this weird issue. I need to see the doctor. They're just kind of embarrassed. So what do? Fortunately, they don't do anything. They let it go. If you can have the availability to allow them to book an appointment, you're alleviating that concern and letting them do it right away. Now, search engine optimization, SEO, it's very important. And what this is building your site with the keywords and key phrases that the search engines like Google's and Yahoo's and groups like that will take and really boost your rankings. Because everyone wants to be on the first page of Google. You don't want to be on the 100th page because no one's going to find you. So building your site with original content. You can't copy and paste content from another site. You have to build it with original content and talk about, what is that you want to offer. Why should patients come see you? And if you do that, they'll have an easier time finding you online. Another area that can encourage you is if you accept patients, if you speak different languages, if you expect patients from different languages, translate your website pages into the different languages that, from those patients you're trying to attract. Now, search engines love this. It'll help you move up higher in the rankings and all that, but patients will appreciate that you're willing to communicate to them in their native tongue. And yeah, it sounds neat on the surface, but if you think about it, little differences make a big difference. Just take the different types of English that's spoken or written. People that live in London speak differently than those who live in New York City. So, I feel it's very important to make sure that your site is written in the way that somebody will want to review it. Okay, and if you can do that, you're going to capture more and more patients. Now, I want to spend a little time about targeted email marketing. It's important. It can be great, but let's talk about what it is and what it isn't. Because if done correctly, it can bring you great results. But unfortunately, if done as most companies do, it can be disastrous. So, on that note, what do people do? Well, typically, many companies, they have one database, and they send out, one generic form-style email to their entire database, including newsletters, updates, etc. Blast them out there, and they don't get a good return on it. Why? Because that's not true targeted marketing. What is separating your contacts into different categories and then creating more targeted emails, creating emails specific to those groups that you're looking to capture. Now, why don't people do it? Because it takes work. It takes a lot of work to create and maintain lists. It takes work to create customized emails, and it takes work to analyze and improve upon them. But hard work does pay off, and hard work, if done correctly, will lead to a more productive marketing effort that will give you proven results. So what I want to do now is spend a little bit of time of, what is it? How do you target? What's the right way to target so your message is effective and profitable? One way is appointment reminders. This would be something, hey, I want to remind you that you're scheduled on Tuesday for whatever procedure with Dr. So-and-so. And so I want to, tell you, here's what you should bring, a list of what you should bring to the hospital with you. Or, want to remind you, not to eat any food, after midnight, the night before your surgery. Something little that can help to limit the questions and the problems of that day, but that people respect and that you can bring value. Here, the whole point of a targeted email is to bring value to those that you're trying to reach. Another would be cross-promoting your services. A patient comes in to you for X procedure, but down the road you might get them back for a Y procedure. Plastic surgeons have been doing this for years. You come in for something, and then you come back again months later for something else. It's great, it's beautiful, and it can be replicated. Newsletters and education on hot topics. Okay, if it's flu season, sending out a message to your existing patients. Hey, it's flu season. Why don't you come in, get a shot, so you won't be sick. It's allergy season, same thing. Sports physicals, whatever it is. The important thing is to have a monthly theme that you're reaching your patients in a manner that brings value, so that you don't annoy them, but yet they want to come back into your office and receive more treatments or whatever it is you're trying to get. This is a very effective way to turn prospects into patients. Now, emails, still get results, but it's the right messaging to the right type of individual at the right time that makes all the difference. Okay, so spend a lot of time here talking about the importance of having a well thought out marketing plan, some things to do, some things not to do. And here I think, as you can see on the screen, some items here. I think it's important to share with you some tips that we share with our clients that can help generate more of a patient inflow into your practice or hospital. The first is you got to have a simple description of what you do, what sets you apart. This is something that will attract patients. Okay. The second area that's important to do is it's important to remember to take the time to find your target audience. Keep in mind, be very specific as to the demographics, the psychographics of what your ideal patient is. Focus your resources and marketing tactics on these groups and these groups alone. As we said, a few slides back, don't get distracted by others. Focus on who you want to reach and do just that. A third is make sure that you set goals, okay, for your practice. Knowing what you want to achieve, okay, both short and long-term objectives is critical to goal achievement. And it's important that you create concrete goals, such as what are your revenue targets, or what's the number of new customers that you're aiming to bring in your doors in X amount of time. It's important to have this all written down so you can keep your eye on it and track it. Identifying your competition. Sounds easy, but a lot of folks, unfortunately, don't do that. It's important to know what are the practices around you or hospitals around you doing, and what are they offering. Why are folks choosing them over you? Is your practice unique? If so, what sets you apart? And then use this in your marketing plan. Something that, again, that sounds easy, but most don't: establish a marketing budget. You'll be amazed once you get going at how fast your marketing expenses can add up. It's important, set aside a specific amount of money each quarter and then evaluate which efforts are working and which ones aren't. It's important. Track each initiative. Keep what's working. Don't keep what's not working. But you have to set aside that budget so you can make it all work. Another area is look at channels of distribution. Brainstorming is great, and I always recommend brainstorm a range of ideas to reach your target market so they can perceive your value message. Now, it sounds kind of fancy here, but really it's important. Be creative. Don't censor or don't disregard any wild ideas. I never think any idea is too big or too small, because you never know. The important thing is put them all on paper. Pick at least 5 of those that you feel you can execute within your budget that you set that you'd already established, and then the important thing: execute. Follow through with that plan. Now, set timing for each step of the plan is very important. You have to establish a timetable for each step. There's 2 requirements for a goal to become achievable. One is you got to set out what is it you're trying to do. What are your objectives? Okay, and they have to be realistic. Number 1. Number 2, you have to have a date that you're going to accomplish it by. It's very important. Set out what is it you want to do and when are you going to do it by, and then track it. That leads us to the last one. Hold yourself accountable. The best thought-out marketing plans fail because oftentimes they end up in the bottom drawer of your desk as opposed to on your desk being executed upon. It's critical to have an objective coach hold you accountable for taking charge and following through with your plan. A few more tips and pearls. Marketing isn't everything, as the title here says. What's your business? You need to know your business inside and out. What is it that separates you from every other practice or hospital that's like yours? It's very important to know this. You should be able to define this in 1 sentence and be able to verbalize it in less than 8 seconds. I'm going to repeat that. You need to find out what is it that separates you, what are you good at, and be able to verbalize it in less than 8 seconds. Who are your patients? You need to know who your patients are. You need to know them by name. You need to become familiar with them. Your clients. I know my clients by name. You should know all of your clients by their name. What is it that actually, what is it that your patients actually consider valuable? Knowing what's important to them, to your patients, and what their needs, what their wants are, is critical. Okay, find out what's important to them, and then help them alleviate that pain if that's the issue. Whatever it is, you have to know what's important to them. And how do you distinguish your facility or your practice? There's so many practices out there. It's important, if not critical, to be a practice or a hospital or a clinic or whatever that sets itself apart from the rest. It could be a procedure you do. It could be a treatment you do, new technologies. It could be the way that your staff handles the patients that come in the front door, knowing each patient by their name, short wait times, whatever. I get really annoyed when I go to the doctor and they ask me what my name is, and especially my last name. I know what their names are. They should know mine. That's my feelings, and that's how I treat my clients, and that's how I expect to be treated. If you're not doing that today, then you need to start today doing that. Well, I've been spending some time saying, here's what I recommend you do, but let's spend a minute or two talking about, what is it that patients are looking for in hospitals. Well, what you see on the screen are really a lot of the items that will influence a patient's decision when it comes time for them to choose a hospital. Now, of the 6,500 hospitals in the United States, most are categorized as general hospitals, which just means that they're capable of dealing with a very broad range of medical conditions, okay, and especially those that require hospital treatment, all right? But there's also about 1,000 hospitals that specialize in either a certain disease or condition, so such as orthopedics or cardiovascular disease or something like that, or in a certain patient population, such as children or elderly or whatever. But these specialized hospitals or centers of excellence, as we call them, are likely to be the best informed about emerging treatments, emerging technologies, things like that. Kind of the best of the best in those realms. And if that's you, if you specialize, if you're an expert in a certain disease state or a certain patient population or whatever, that's the message that you need to convey. Patients are looking for features that distinguish their location, okay, or your location as being the best. Because when they make that mental comparison, that's when they can rationalize choosing you over choosing somebody else. So we talked a little bit about internal and external marketing, and I want to spend a minute here talking about new patients versus existing patients. I can't stress it enough. It's important to not just market to new patients. Instead, you have to include in your marketing strategy new patient retention. Okay, and with that, monitoring patients that are leaving and ask them, why did you leave? Why aren't you coming back? Because they'll tell you, and the results might be astounding. I mean, measuring the results of a procedure against the patient's expectations will allow the doctor to know, hey, where were they strong? Where weren't they? Maybe they should have changed the way they gave their patient the education about the surgery or whatever it is. But it's important to find out. As I said earlier, it'll cost you 5 times more to get one new patient than it is to keep an existing patient. Very important. I think we just went over this, but again, I can't stress it enough. Image is everything. You have to have a clean place. You have to have a polished staff that can really be available to the needs of the patients. And having a rapport is critical. I mean, once you've established a doctor-patient relationship, you can follow up by helping patients better understand the benefits of what you provide. As I just said, image is everything. It's not just your appearance, but it's the image of the practice. It's when you walk in, is it a clean practice, or is it a dirty practice? Is it organized or is it unorganized? All of these things play into a patient's subconscious when they're making a buying decision. And yes, when the patient agrees to go to a hospital or a doctor's office or whatever, that is a buying decision. Get to know your patients by name. 68% of patients will leave your practice because of indifference. The vast majority feel unappreciated or taken for granted. How many times should a patient have to come in and be asked, what is your last name? I just said before, a couple slides ago, I can't stand it when I go to the doctor and they don't know my name. They should. Again, I know my clients' names. They should know their client's name. That's my personal stance. That's what we drill into our clients. It's very important. It's also important to make sure that your staff has the skills to be able to interact at the level that you're expecting of them. Okay? When the impression that a patient gets of your hospital or your practice starts with the first person that greets them at the door. The first person that answers the phone and says hi to them. That's the impression. It's true. You don't get a second chance. First impressions are everything. You have to have a properly trained staff that can do this. Some of our clients actually hire what's called mystery shoppers. They make some calls. They'll stop by the offices and kind of talk with the staff, acting as patients and or potential patients, and then report the performance of the staff. Sounds kind of funny, but it's better to pay the money up front than to lose more money when patients are leaving your office. Again, 68% will leave your practice due to indifference. Another area that can help you retain patients is conducting patient education seminars. Okay, lunch and learns, becoming an active member in your community, somewhere where you're bringing value to them, okay, and really being seen as an expert. That will keep your patients and drive in referrals. And strategic partnerships, I think, are essential. It's important to partner with experts because not only will the results be better, but the cost of attracting and maintaining patients will be much lower. You wouldn't go to a cardiovascular procedure by someone that hasn't had the right training. It wouldn't make sense. Marketing and attracting more patients, filling their ORs, all that, it requires a certain skill. And just to show you what some things that we do for our clients, we help them connect medical providers to a variety of patient types, from insured patients seeking additional surgery options, underinsured or uninsured patients seeking quality, affordable treatments, whatever it is, we're able to do that. And I strongly encourage you to partner with someone that has the expertise in doing that. It makes all the difference. So to recap here, you may want to try many or all these options that went over today. But the point I want to stress here is that there's different markets, different geographies, different patient audiences, and everybody will respond differently. Please think of marketing as a whole pie with different sections cut out. It's imperative you treat each one independently, but allow for them to all come together into one large pie. It's important to create an action plan with realistic goals. And please, I hope that you start doing that today. With that, I think I've pretty much gone over time here. But as you can see on the screen, there's my number, my email. We're Health Options Worldwide if you want to reach out to us. I'd love to hear from you. Please send me any questions you may have or any ideas for that you'd like me to cover in another webinar. We typically do these the first Tuesday of each month. And I really appreciate all of you joining us today. Thank you and take care.